Good morning, ladies and gentlemen. It's time for a Henry County Health Center FYI. And this morning we're talking with Southeast Iowa Regional Hospice. We have the director with us over the phone, Shauna Freitag. Good morning.
Well, good morning.
So happy to have you on KILJ this morning. Let's just start off with you giving us some information about your background and your role with Southeast Iowa Regional Hospice.
Absolutely. So I have been the director with Southeast Iowa Regional Home Health and Hospice since July of 2021. Came on board at an exciting time when they were changing from Great River Hospice and adding the Fort Madison campus. So I am now the supervisor and director over both the West Burlington Home Health Care and Hospice in addition to Fort Madison. And now with having Henry County, we are expanding our hospice services into the Henry County area. So very passionate about home health care and hospice. Personally had to experience home health care and hospice with my father. So it's something I'm very passionate about and I love very much.
It's interesting that you say that because that was also my experience with hospice was with my father.
Aw.
So when
Yeah.
we talk about hospice, maybe some listeners may not be familiar with what hospice care is. Can you explain what it is and the benefits to the
Absolutely.
patients and their families and all the reasons why people choose hospice care?
Absolutely. So I often share this story. I think I had the common thoughts like a lot of people that, hospice is there for your final days or your loved one's final days. And I will never personally forget the call where the case manager called and said, Shauna, I think it's time to put your dad on hospice. And that instant dread, like, oh my gosh, I'm not ready. Why are we talking hospice? And they reassured me, this isn't going to happen tomorrow. It probably won't even happen next week. We just noticed with the decline, death is inevitable. He had Parkinson's and Lewy body dementia, and he was slowly declining. So hospice was absolutely amazing. For me personally, they allowed me to be that daughter. Even coming in with years of experience with social work being my background and psychology and caregiving, they really took that lead role to advocate for my dad. One, make sure that his pain was managed emotionally, spiritually. They really take care of not only the patient, but the family. And I think, Katie, what we find is that people don't realize that hospices can be more than 6 months. But to enroll in hospice, the physician has to agree that, one, the patient has to have a terminal illness, and then with the natural progression of the disease, that, inevitably 6 months or less, the patient could pass. Now, like in my personal situation, my father was on hospice for 2 years, and was reapproved because of that ongoing decline. You never know. But we're definitely always trying to break that stigma that hospice is last days. And, believe it or not, Katie, people actually graduate from hospice. Once we're able to manage those pain and symptoms, sometimes people do better and actually come off hospice. And then they can always re-enroll later at a later time. But we're there for the major pain and symptom management. We offer, what's really neat is we have a disciplinary team. So you're not just getting a nurse. You're getting a social worker, a chaplain, an aide if you need it. All kinds of different people come around you to support you. But the criteria is terminal illness, 6 months or less, and then they also have to agree to no more aggressive curative treatments. It really needs to be mostly focused on palliative care, so keeping them comfortable.
I know you mentioned a few of the different people that work at the Southeast Iowa Regional Hospice. But so talk about them. Describe the staff and the important role. I know volunteers also play a part in
Yes.
delivering the service.
Yes. So every Tuesday, bright and early, 7 a.m., our entire, what we call our interdisciplinary team comes together and we talk about our patients. How are they doing? What do they need? That does include your chaplain, your social worker, your nurse, the director, the supervisor. We also have a medical director that oversees that care, and then our volunteer coordinator. And sometimes it's not medical. Sometimes it's emotional needs. It's resources from the community. Sometimes they just need a volunteer to come sit with them. Volunteers are very vital to the work that we do. And volunteers that we have almost 100. They serve in various capacities. So some just want to do administrative and clerical work. They want to come in and help with paperwork, bereavement paperwork, grief groups. Some want to come in and actually do direct care. And that might mean sitting down with a patient so that a caregiver or a loved one can go do some grocery shopping, go pick up some meds. maybe just reading to them. Some are just lonely. I think there's a common misconception, too, that we only provide hospice at our hospice house. We go into homes, we go into facilities, assisted living facilities, nursing homes. So these volunteers, depending on their comfort level, can do direct care or administrative, but they really help us do all the wonderful work that we do.
So how does one get involved with volunteering for hospice?
Well, we actually have a training coming up in Mount Pleasant in March. Volunteers are required to have 16 hours of training. So we break that up over a couple Wednesdays where they'll come learn everything that hopefully they need to know to feel comfortable providing that volunteer care. So we'll learn from the nurses how to feed, how to recognize pain, all kinds of different things. So they attend that training, and then at the end of that training, they have a graduation and can kind of decide at that point, after hearing from other volunteers, where they want to start. We also have volunteers that staff our hospice house. So they're the greeters and kind of the hospitality of family members and different people that come in and out of the house. They could work at the house, or they can do some of those other things mentioned previously. So, but if you're interested or somebody out there would like to learn more, definitely call us at the West Burlington campus, and we can get them more information about the upcoming training in March.
Fantastic. Such a important role that you're playing here when we talk about healthcare in Southeast Iowa. So besides the training that's coming up, I know that you guys also have another big event. Do you want to talk about the Pack the Gym in Pink and why these fundraisers are so important to Southeast Iowa Regional Hospice?
Absolutely. So hospice is typically a Medicare benefit that has little to no cost to the family. When they come on board, we're able to provide anything and everything they need, from medications to equipment. But there's some people that fall through the cracks, particularly those who are younger, maybe a cancer diagnosis where they may have an insurance or even no insurance, and that don't have that hospice benefit. What we do with our fundraisers or the funds that we raise is we ensure that everyone, regardless of their financial situation, can have the hospice services, whether they want to come to the house or they want to be served at home. So these fundraisers are really important in what we do. Also helps for basic resources. For if the family would need something. We had a patient that they didn't have a working door, so we're able to go in there and make sure that they don't have cold drafts and the family is comfortable. We've had fundraisers specifically for different things. So this one in particular is Valentine's Day themed. It's perfect timing because it's February 8th. People can come out and we have a silent auction with all kinds of Valentine's themed baskets. We have some rolling in now. I know there's a coffee basket that's I love you a latte. We have a garden basket. All kinds of the community comes together to put these baskets together, and then we auction them off in a silent auction. We also do a live auction, a dessert, and this is how we raise the funds for some of those events or those things that we do. So February 8th at Southeastern Community College, 7 p.m. It is free to get in. It's by free will donation. So you give a donation to hospice, and all those donations come back to us for admission. And then, like I said, we have the silent live auction. We have T-shirts available, the Pack the Gym in Pink. It is so neat to go in there and see the stands just filled with pink T-shirts. So we also sell those in advance. And then the rally towels. Those have been a big hit. So for $2, you can buy the pink rally towel to cheer on your Blackhawks.
So many ways to get involved, and I'm so glad that we're learning more and more about hospice and that you come on and do shows like this to kind of explain the wide scope of the services that you offer here at the Southeast Iowa Regional Hospice. Well, Shauna, you've given a lot of information. We've got the volunteer training in March. We've got, in a few days, on February 8th, the fundraiser. What else? Is there anything that we missed this morning that you wanted to make sure to tell people about when we talk about regional hospice care and what you guys are doing?
No, I don't think so. I think everyone, just regardless of your age or your current medical condition, reach out and learn more about hospice. I think it's good information for all of us to have in planning for that journey.
Thank you, Shauna Freitag, the director at Southeast Iowa Regional Hospice, for being our guest here on the Henry County Health Center FYI. Thanks for coming on this morning.
Thank you. Have a great day.